Hello, my name is Binia Mayal. I am a global Atlantic Fellow for Equity in Brain Health. My research mainly focuses on Alzheimer's disease and related dementia and brain health, especially in preventing dementia. So for today, I would like to talk about strategies that promote brain health. Actually, currently, scientific literature showed 40 to 45% of dementia can be potentially preventable. Even though aging is something the major risk factor for dementia, we cannot modify age, but we can modify other factors, lifestyle modification, how we can, what to eat, to exercise, and preventing some of chronic cardiometabolic diseases that will help us to stay healthy, to have healthy brain and promote healthy aging. So the first one is exercise. Exercise is very important in boosting blood flow to our brain. Generally, it will enhance our brain health. Our target is usually under 50 minutes per week, which is around 30 minutes of exercise every day for 5 days. So 5 days per week of exercise is encouraged to stay healthy. Second thing is diet. Diet is very important. Eating healthy, which is mostly Mediterranean diet, and mind diet, which is rich in vegetable, fruits, olive oil, fish, and things like that. The other is good sleep. Sleep is very important. We have to have adequate sleep, which is 7 to 8 hours of sleep is recommended currently. The other factor is preventing or treating some of chronic disease like hypertension, diabetes, obesity, dyslipidemia. We have to control our blood pressure, control our blood sugar, control cholesterol, and this cardiometabolic disease, kind of preventing this will, or managing them well, will help us to stay healthy, as well as preventing especially vascular dementia. This type of dementia which is commonly associated with this kind of diseases. The other one is socializing. So socializing is very important, because social isolation is one of, especially in late life, isolation is a risk factor, could be a risk factor for dementia. So this is important to stay active, in contact with family, socializing. That will actually prevent depression, as well as kind of keep us socially active, and our cognitive health will be will benefit from this. The other thing is avoiding smoking and limiting alcohol intake. So at least scientific literature supports this kind of behavioral modification. Smoking obviously has a bad adverse effect on our health. The same is alcohol. The other factor is cognitively being cognitively active, which means like could be reading, could be learning new language, could be anything that could stimulate our brain by learning new condition. Could be bingo game for older adults, playing puzzles, as well as reading books or reading different material, and making our brain active. That will make actually improve our cognitive reserve and cognitive resilience, which is actually beneficial in long term in preventing and able to maintain our brain health. So other factors are generally having a close follow-up with our healthcare system, maybe annual physical examination, and if you suspect anything, any kind of cognitive concern, being screened earlier, getting assessments, and looking at our cognitive capacity. If there's some issues that could be concerning to us, it is important to visit healthcare setting and able to identify early. So as long as we able to identify early, it's always good. uh, Rather than presenting to healthcare in an advanced disease stage, it's always good to able to identify diseases much earlier. So it's very important to uh, know these factors, that they are very much beneficial for our brain health in a long term also. They will help us to stay healthy and promote healthy aging. So this is things I like to talk today. We'll try to discuss other factors also, because there are several factors that can potentially be preventable, but if we are missed it, and if some of the evidence may support that these are associated with or increase our risk of dementia. So we'll discuss the other factors in future videos. Thank you.